Today with us, we have Dr. Joel Charles discussing the COVID 19 outbreak. So, where are we locally with the COVID 19 epidemic? Do we have any local cases?
Yeah, so great question. One of the most important questions. So far, we haven't had any positives. However, I am operating on the assumption that it's already here in the county. And the reason for that is this: we don't really have the ability to test anyone who has symptoms. So mostly we're testing people who are hospitalized or certain other groups of people like healthcare workers, public servants like law enforcement, or people who are likely to get really sick from it. So you aren't really testing everybody, and the fact that we haven't had any positives doesn't mean that it isn't here in our county. There obviously have been cases in La Crosse County, Richland County, sort of all around us, and we've been pretty fortunate so far to not have any hospitalized folks with it, but I'm assuming it's out there.
Right, yeah, and it's probably in our back door. We're just waiting for it, right?
Mm-hmm.
Can you give the listeners some of the basic education that we need to know with this situation?
Yeah, so the virus is new to humans, and some important things to understand about this is because it's new to humans and we aren't immune to it, that short of having a vaccine, anywhere from 40 to 70% of people are going to get this at one time. And the question is that spread over a couple months or is that spread over 18 months? Short of a new medicine, probably 1 in 6 of the people who do get this are going to be hospitalized, and maybe 1 in 20 of those people who do get it are going to end up in the ICU. Right now, we don't really have control over those numbers, how many people get it, and how sick people get from it. But we do have some amount of control over the time spread on it. Broadly speaking, we have 2 ways to control whether this is spread over 2 months or 18 months. The first one is to do really broad testing so you know exactly who has it, and then you trace their contacts to know who they came into contact with, and you isolate all those people. That's a really efficient way to do this. Unfortunately, we didn't have the testing or the public health infrastructure ready to do that, and so that train has left the station for now. We're actively building the ability to do that in terms of producing test kits, ramping up public health's capacity, but we're really not there right now. That's why these aggressive social distancing measures have been put in place, because the other way that you can kind of spread this out in time is to just not have people be around each other as much, and so it doesn't spread as quickly.
And what are the current projections that we see going into the future?
As of today, the numbers that we're operating on are projecting a peak demand for the first wave of around April 15th. In the state of Wisconsin, that peak is probably going to happen around April 27th, but it's important for people in this area to know that because we're in a rural area, we're probably maybe a couple weeks delayed from that, maybe more or less. It's hard to say exactly, but our situation in rural areas isn't going to line up perfectly with some of these larger scale numbers.
So, we were talking a lot about numbers. Can you break that down in another way?
Yeah, so I'd like listeners to imagine that there's a forest fire, and there are a bunch of houses in this forest, and the goal is to save the houses. But you know going into it that half the forest is going to burn. So your number one goal is to make sure that the fire spreads through that forest as slowly as possible. The best way that we can control that fire is one of 2 things. One, to know exactly where the fire is and to isolate those fires, which is sort of like testing, which essentially we can't do enough of yet. So the other way is to slow the spread of the fire itself. And the analogy here is that people coming into contact with each other is like a fan that's flaming this forest fire. So essentially, by telling people to minimize being around each other, we've kind of turned off the wind, made the fire spread a little slowly so the firefighters can focus on saving the houses that are currently on fire. There's a really important thing for people to understand here, which is I earlier referred to this kind of first wave of cases in demand. So what people are going to see is that we're going to have this peak of demand, Wisconsin-wide, maybe April 27th, and that's going to subside. It's important for people to know that the fire isn't out at the end of that, because at that point, most of the forest hasn't burned yet. we're left in this situation where you have the rest of this forest that's vulnerable, and because we don't have enough testing, in effect, you have these hidden embers that are still out there. And so if people stop doing their social distancing, the wind picks back up, the fire spreads again. And that's what we're worried about. So I can't speak for what public policy is going to be around this, but essentially the thought amongst public health professionals is that you don't want social distancing to end until you know exactly where every ember is and you can focus on those individual embers. And that's really where we're at in terms of preparing for what we're going to do after this first wave. But it's really important for people to know that when things look like they're improving, the hospitals are less overloaded, that we're not out of the woods, and people need to still follow the advice of officials on social distancing measures. Because we can't say what's going to happen, and because there are these hidden embers, in effect, we need to be prepared as a hospital system and a public health system for the possibility that there's going to be a spread of the fire again. And that's what we're working on right now. We're getting ready to deal with kind of this first fire and then be prepared for later fires.
Yeah, that's a really good analogy and definitely makes a good picture, I think, of what's going on. So how does being in a rural area change the equation?
That's a great question, a really important one. I think, a lot of people see these huge numbers in Madison and Milwaukee, and they think that's because those areas are more densely populated. Yes, it's true that those areas are going to see higher numbers, and they were hit sooner because they're more populated, but those people in those areas aren't inherently any more vulnerable than people are here. Biologically, we're the same. So people out here are no more immune to it than people in cities. The difference is that those cities are getting hit sooner because they have a harder time keeping people away from each other. But at the end of the day, 50% of people here are probably going to get it. 50% of people in Milwaukee are probably going to get it, unless, of course, there's a vaccine. The difference in being in a rural area is that we've had time to prepare, which is incredibly useful. So VMH has been working really aggressively for the last month to prepare for this, and we are so grateful that we've had the time to do that. There are a lot of rural areas, on the other hand, where it's a double-edged sword, because in very rural communities, there are just less healthcare resources, so they're less prepared to deal with this. Thankfully, overall, Vernon County and the surrounding area are pretty well supplied in terms of healthcare resources, so we're lucky in that regard.
Absolutely, and very happy to have VMH in our county. And going further with that, what has VMH done in terms of the preparation for the COVID-19?
Well, we've been working basically night and day on this, and we've been lucky in a lot of regards. First, like I said, we had time to prepare on this, and we've been doing that. We've been lucky to have a lot of smart folks who kind of brought this to our attention early on and really pushed us to be aggressive in acting. We've been lucky to have administrators who've been really responsive to this and really sort of taken the lead in organizing people to get prepared for us. Also, we're lucky in that it seems that the community is following these social distancing recommendations. So broadly speaking, what we're doing is preparing for an increase in volume of people who have COVID. We're designing both the hospitals and the clinics to operate in a way that keeps people who potentially have COVID separate from people who don't have it, so that way we can, as much as possible, continue our usual operations to take our usual good care of people while not putting staff and those patients without COVID at risk.
And I've seen a lot online, a lot of nurses and healthcare professionals being extremely overwhelmed by this all around the nation. How do you feel we are prepared at Vernon Memorial Hospital with workers?
That's a great question. So, as soon as we saw this happening, we prepared for sort of maximum volume situations in case something happened here, like in Italy or New York. Right now, we think this is going to be spread out more broadly than it has been in those places, so we don't think our capacity is going to be exceeded. However, we are 100% preparing for that possibility and making sure we can take care of as many people as possible. At the same time, to your question about staff, we are really carefully planning on how to keep our staff safe. So being judicious with the use of our personal protective equipment, ordering the maximum that we can, and continually looking at the evidence about what is the best way to keep people safe, both from their sort of personal protective equipment, but how to design the operations of the entire hospital and clinic system in a way that keeps staff as safe as possible and keeps patients who don't have COVID from getting it from patients who do have COVID.
I'm sure you guys are working extremely hard, and I know you guys are still working on general care to patients in the community. How is that being affected with the COVID-19 outbreak?
Yeah, that's a really important question. We don't want to lose sight of the fact that there are tons of people in the community who need regular quality care for the issues that they had before this and the issues that are still going to be here after the COVID problem goes away. We have temporarily significantly decreased the volume of in-person care in the clinics and are being really thoughtful about how that works. That's been really helpful. At the same time, we've implemented plans to keep the clinics as clean as possible. So we have sort of this red, yellow, green system that sort of looks at somebody's probability of having COVID, and we keep the clinics and the hospital as separated as possible in those terms. So that way we can continue to bring the people in who need to come in and not feel like they're at risk of either getting COVID from a patient who has it or getting COVID from a provider.
And I know a question that a lot of people have been asking is, when is this going to be over? How long can people expect to be socially distancing? And what happens if social distancing ends early?
Those are all, again, really important questions and questions that all of us are asking ourselves every day. I know I ask myself that question 20 times a day, and a lot of people are looking to me and other providers for answers on that. Again, to go back to the earlier discussion, even after this first wave is done, this virus still will have only touched a small percentage of the population. So without a vaccine, what we really need is the ability to test broadly, find out who has this, and keep those specific people isolated. Until we have the ability to do that in terms of the testing and the public health infrastructure, our only option is to keep people away from each other. Going back to the example of the fire, if you don't know where the embers are and you haven't isolated them, you sure don't want the wind to pick back up. And I want to say here first how grateful everyone is at VMH to this community for the fact that they have implemented these social distancing measures. If you hadn't done that, or if you end these earlier, then we would be facing a scenario where we would get overwhelmed in our ability to take care of people. So you're really helping us out and helping the community out by doing this. And I want to also acknowledge that this has been incredibly impactful on people's lives. This isn't just as simple as people not being able to go to work. There's some people who aren't at work right now and they don't know if they're going to have a job when they get back there. And I want to acknowledge how devastating this is to some people's lives and to really express gratitude on the part of Vernon Memorial Healthcare that people have taken these really disruptive steps to allow us to take care of the community and also to protect the other people in the community. That's no small thing that people have done, and all of us at Vernon Memorial Healthcare are grateful for that.
And we're thankful for all the work that you guys are doing over at Vernon Memorial Hospital, that's for sure. And one more time, could you give any more resources that we need to know, the COVID-19 nurse line maybe, or anything along that lines?
Yeah, absolutely. Again, and I sort of mentioned this last time I was here, I think the New York Times has really excellent reporting on this right now, and they are providing that for free. All you have to do is sign up with your email address and create a login, but it's free. So I recommend for people who want to have quality reporting on this. I know not everybody loves the New York Times, but I do think that they are really accurate in this case. But in terms of local resources, you know, for people who go to Vernon Memorial Hospital or the clinics or local Gunderson Clinic for their care, if they do develop fever and cough or shortness of breath or what we call respiratory symptoms, we do want them to call our respiratory triage hotline. It's 608-637-4990. Again, that's 608-637-4990.
We want to thank Dr. Joel Charles for coming in and discussing the COVID-19 outbreak.